Hello friends, in this module of sports medicine we will understand the risk factors and causes of sports injury. The term, sports injury, refers to the kinds of injuries that most commonly occur during sports or exercise, but they are not limited to athletes. Factory workers get tennis elbow, painters get shoulder injuries, and gardeners develop tendinitis, even though they may not participate in sports. Ultimately, however, sports injuries refers to those that occur in active individuals. Sports injuries are divided into two broad categories: acute and chronic injuries. Acute injuries happen suddenly, such as when a person falls, receives a blow, or twists a joint, while chronic injuries usually result from overuse of one area of the body and develop gradually over time. Examples of acute injuries are sprains and dislocations, while some common chronic injuries are shin splints and stress fractures. Treatment for a sports injury depends on the type of injury, but minor ones can usually be treated at home by resting, icing, compressing, and elevating (RICA) the injured part of the body. The risk factors for sports injuries include not using the correct exercise techniques, overtraining either by training too often, too frequently, or for too long, changing the intensity of physical activity too quickly, playing the same sport year-round, running or jumping on hard surfaces, wearing shoes that do not have enough support, not wearing the proper equipment, having had a prior injury, having certain anatomical features specific to each joint or poor flexibility. The type of injury you are most vulnerable to depends on the type of activity you participate in, your age and your sex. Internal risk factors that may predispose an athlete can include age, biological sex, body composition, health, physical fitness, anatomy, greater than skill level, psychological factors. When an athlete is exposed to external risk factors, they become susceptible to injury. External risk factors include sports factors, protective equipment, environment. When an inciting event, i.e. injury mechanism, occurs, the athlete is injured. Examples of inciting events are playing situation, player, opponent behavior, gross biomechanical description, whole body, detailed biomechanical description, joint. Sports injuries are broadly categorized into two kinds: acute injuries, which happen suddenly; chronic injuries, which are usually related to overuse and develop gradually over time. In some cases, wear and tear from overuse injuries can set the stage for acute injuries. Cause of sports injuries. The cause of an acute sports injury is a force of impact that is greater than the body part can withstand, while a chronic injury is typically due to repeating the same motion over and over again. Sometimes, overuse injuries can degrade tissues and joints and set the stage for an acute injury. The various causes of sports injuries are: first, improper warming up. A sportsman may get injured during training or competition due to improper warm-up training or competition. Second, improper conditioning. Without proper conditioning, it is natural to get injured in sports. Third, unspecific way of training increases the occurrence of sports injuries. One should have knowledge of overtraining and undertraining. Fourth, lack of fitness. If the player is not physically, psychologically and physiologically fit, she may get easily injured. Fifth, lack of proper nutrition in food can be the cause of sports injury. Lack of calcium, phosphorus and vitamin D may be the cause of bone fracture. Sixth, no use of protective equipment increases the chances of getting injured. Protective equipment provides safety to delicate human organs. Seventh, lack of sports facilities can be the cause of sportsperson's injuries. If the ground is not smooth and there can be ditches in it, there can be abrasion, sprain or fracture to the player. Eighth, practice during the stage of fatigue increases the chance of getting injured. Anticipation power decreases in the stage of fatigue, and as a result, the person may get injured. 9th, carelessness during the games can be the cause of getting injured. 10th, improper sports equipment may also be the cause of sports injuries. All sports equipment should be of international standards. 11th, pressure of competition. Stress increases enormously during international sports competitions. At that time, dignity is attached to her country. Players exert maximum force, usually beyond their capacity, in which players may get injured. So friends, hope you have understood well about the risk factors and causes of sports injury.